Hi, this is Oscar. We are going to be doing a dental procedure and a lump removal on him today. So we're going to walk you through the process of how surgery day goes today. So first I'm going to place a catheter in his leg.
Little ones who use tests.
So we just shave a little bit of hair so we create a sterile field. And then we scrub, get it clean. Good boy. All right. Nice ducts and veins.
Good boy, good boy, good boy.
Oh, that's a
Good boy, Oscar. Good boy. Good boy. You're doing so good.
Yeah. Y'all rearranged it. Y'all supposed to know everything.
I never know anything.
Good boy.
Because I opened the dang thing, I still would put the injectable. Forget the injectable again.
I'm gonna put a little injection port so we can.
We're good.
Okay, now we're gonna flush his catheter, make sure it's potent and good, and it is. Good boy. All right. You're being a good boy, I know. We just place this vet wrap here just to protect it, and so make sure he doesn't chew out his catheter like dogs like to do. All right, so now we're going to draw his blood because we like to check their kidneys, their liver, their red blood cells and white blood cells to make sure their body's able to metabolize the anesthesia. So we draw a little bit of blood from the neck here. Hi. Good boy, Oscar. All right. Good boy.
Go.
So now we're just going to get his vitals. We'll check his temp, which we already did. And then we'll listen to his heart and lungs, make sure he's good. Check his gum color. See those nasty teeth that need to be cleaned. And get his respirations now. Okay. Good boy. All right, now we'll run his blood work and we'll go from there. This is your baby. First blood work, just to make sure, like I said, he is good for anesthesia, to make sure his kidneys and his liver can metabolize the anesthesia. So this is all of our lab equipment that we use. Can I get in? Yeah, let me get out of this sign right here. Maybe Oscar. check his red blood cells and his white blood cells. This machine is going to look at his electrolytes and his chemistry, such as his kidneys and liver.
You are so jealous. Why is it that dog
Okay, so the blood work's going to probably take about 5 to 10 minutes. So once the results are in, we will go over them with the doctor and make sure he's good for surgery. Schneider is doing his exam before his procedure. Make sure he's good. His blood work was all normal, so he is good to go on his dental cleaning. Going to listen to his heart and lungs, make sure there's no murmurs, no abnormal sounds of the heart or lungs. And this is the lump we're going to be getting removed here, his little friend here. And then this is what his teeth look like before. So we'll show you the afters when they're done. Doctor is under anesthesia for his dental procedure. Kristen is an LVT, meaning she's a licensed veterinary technician. She, went to school, took her boards, took a lot of work having to get that title. And this is Stephanie. She's a CVA. She's a certified veterinary assistant. She also had to go through some training to get that certification. So she's monitoring Oscar as he's getting his dental procedure done. Right now, Kristen is getting the tartar off that is present on the teeth. And then she'll be probing his teeth to look for any pockets to see if we have to have any extractions done. All right, so now Kristen is scaling his teeth. It's very similar to whenever you go to your dentist and get a deep cleaning done. So she's scaling the tartar and plaque that's present. While that's going on, Stephanie is monitoring his vitals. He is hooked up to machines, and she's manually listening to his heart, listening to his lungs, taking his temperature. He's also on IV fluids during the procedure to hydrate his internal organs and maintain his blood pressure. Also, he is on a warming blanket to help keep him warm during the procedure so their temperature doesn't drop, to keep them nice and warm. So once Kristen is done here scaling his teeth, she will polish them. All right, so now Kristen is polishing his teeth. We use the same paste as the human dentists use, except for it's pet friendly. And we have our cool little dental prophy heads. We're using a tiger today. So he is almost done with his dental procedure. Dr. Schneider will come and take a look at his teeth, what she's finished, to see if he's needing any extractions. And once that's done, then we will move into surgery to have his lump removed. So now, this is the lump that's going to be removed. So we'll show a video of that shortly, but this is the before. Oh, and this is the after of his teeth. They're nice and shiny. He did have to have 2 extractions, but now he's got nice pearly whites. All right, this is the finished product. There's the sutures, and then this is the lump that was removed, which is called a lipoma. It is actually just fat. It's a fatty tumor. So it looks good.